Edutainment Studios welcomes you to Healthy Living with HIV, Commitment for Treatment. HIV can be scary and overwhelming, whether you are just diagnosed or already being treated. Today, we will give you some valuable information about HIV treatments, what you can do to live a healthy lifestyle, plus tips for working with your doctor. In this course, the objective is to help you list the options there are for ongoing care, recognize how HIV can affect your mental health, identify how aging can affect you. Plan to see your doctor every 3 to 6 months for checkups. Ongoing checkups will help the doctor know if your treatment is working or if it needs to change, check for any complications from the medicine, find out if you're able to stick to your treatment plan, and find solutions to ease any side effects you may be having. Blood tests are one of the only ways to know if your treatment is working or if your HIV is getting worse. At your checkups, you will probably have a CD4 count test and a viral load test. CD4 count tests will show if the number of CD4 cells is going up or down. If the count is rising, the medication is helping your immune system get stronger. Viral load tests tell if the amount of HIV in your body is going down. A low viral load is the best sign that the medicine is working. The doctor who treats your HIV is probably one of many doctors or healthcare professionals you see. You might have a primary care doctor, a counselor, a dentist, a gynecologist, and others. Think of all these doctors as part of a healthcare team, who each play a role in helping you manage your HIV and keeping you healthy. When you have more than one doctor involved in your care, it is important that they all have the same information. Make sure that you take the most recent lab results, X-rays, list of medicines you take, including vitamins and supplements, updates from all of your doctors, and any questions you may have to each doctor's appointment. If having HIV makes you feel angry, sad, or lonely, you are not alone. It is normal to feel like this every once in a while, especially after you are first diagnosed. But if you notice these feelings sticking around, or if they begin to affect your daily life, work, or relationships, then it is time to talk to your doctor. Treatment, like talking to a counselor, joining a support group, or taking medicine, can help. Living with HIV makes you more likely to have mental health conditions like depression and anxiety. Knowing you are at risk can help you be more aware of changes in how you feel. Not feeling well emotionally can make it harder for you to take your medicine on time or keep scheduled doctor's appointments. It can cause you not to exercise, eat well, or get enough sleep. It can make you more likely to engage in risky behaviors like using drugs or having unprotected sex, and affect your ability to cope with the stresses of daily life and living with HIV. Always be honest with your doctor about how you feel. If you are abusing drugs and alcohol, making the decision to quit can be hard. Not quitting can put your health at risk and get in the way of caring for your HIV. Drugs and alcohol can affect your memory, decision-making, like sharing needles, and make it harder to stick to your HIV treatment plan. If you are struggling with substance abuse, be open with your doctor about the substances you are abusing and how often. Your doctor is there to help you, not to judge. Make a plan to quit. Ask your doctor to recommend the type of treatment you need and how and where you can get it. Share your plan with family and friends and ask for their support. Even if you're managing your HIV and it is well controlled, you can still have or develop other health conditions, especially as you get older. Having HIV and taking HIV medicines could increase your risk of some health conditions and make you more likely to develop these conditions at a younger age. Talk to the doctor about your risk of developing other health conditions, which can include tuberculosis and other lung diseases, cardiovascular disease, high cholesterol and high triglycerides, high blood sugar or type 2 diabetes, hepatitis and other liver diseases, certain cancers including lymphomas, Kaposi's sarcoma, and cervical cancer in women, kidney disease, and osteoporosis. If you have another health condition, the doctor will need to start treating it as soon as possible before it can have a negative effect on your overall health or your HIV. All doctors involved in your care and prescribing medicine for different health issues must communicate with all parties for possible interactions with your HIV medicine. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of this 4-part series on healthy living with HIV, and come back for Part 4.